You are listening to the Toxic Mold Podcast with Steve Worsley, the toxic mold expert and your number one source for mold consulting and mitigation in the USA. Let's dive into a brand new episode. Before we get started on this episode, here's a not so short disclaimer. While all attempts have been made to verify the content provided in this podcast, neither the podcaster or the producers assume any responsibility for errors, omissions, or alternative interpretations of the issues discussed here. All information stated in this podcast is the opinion of Steve Worsley. Steve Worsley is a mold specialist with over 25 years of experience in the construction and mold industry. The Toxic Mold Podcast is for information sharing purposes only. The views expressed are those of the podcaster and his alone. These views should not be taken as expert instruction or commands. While there may be references to medical conditions and symptoms, all podcast episodes are the opinion of Steve Worsley, and any medical questions or concerns shall be addressed with the appropriate licensed medical professional or professionals. As the podcaster refers to different mold types, please be aware that Steve Worsley is not a microbiologist, and questions concerning mold specifics should be answered by the appropriate professional. Steve isn't, nor does he offer any legal advice. For any legal advice, you must speak with a lawyer. The listener is 100% responsible for his or her own actions. You can check out Steve's books on Amazon. Just go to Amazon and search for author Steve Worsley. You can also take Steve's courses on Udemy or Skillshare, and you can find out more about those at cnccontractorservices.com. Now, let's get to the episode.
In today's episode, we have a special guest. Dr. Diane is an ND, which is a naturopathic doctor, a DAOM, which is a doctor of acupuncture and oriental medicine, and an LAC, which is a licensed associate counselor. Dr. Diane is known as My Lyme Doc, and she has extensive experience with Lyme and mold sickness. Dr. Diane herself fought mold toxicity and understands what toxic mold can do. In today's episode of 257, Dr. Diane and myself have an informative conversation about toxic mold and your home. Dr. Diane is the author of the best-selling book, It's Not in Your Head. Dr. Diane has been featured on Fox News, Dr. Nandy, NBC News, CBS News, ABC News, and many other programs. Dr. Diane has been a guest on over 30 podcasts. In today's episode, we have a free-flowing conversation about mold exposure, mycotoxin testing, detoxing from mold sickness, and the connection between Lyme and mold illness. Dr. Diane will also explain how you can make things worse if you try to treat yourself without proper guidance. Dr. Diane also will announce the release of her comprehensive quiz, which can be found at solvesickness.com. Solve Sickness is a quiz designed to help you know if mold sickness is something you should look into. Dr. Diane has numerous freebies that we talk about, which can be accessed at mylymedoc.com. All of the links that we talk about in the podcast episode will be in the description below. On behalf of CNC Contractor Services, myself, and all the listeners, we'd like to thank Dr. Diane for taking the time to educate us about the medical side of toxic mold. Be sure to tell your family and friends about the Toxic Mold Podcast and listen to this informative episode. Hello, you're listening to the Toxic Mold Podcast with myself, Steve Worsley, and today we have a very special guest. We have Dr. Diane, who has agreed to come and be interviewed. How are you, Dr. Diane?
I'm so good, Steve. I'm so excited to be here with you today. I feel like, this conversation we're about to have I just feel like we can't talk about this stuff enough because so many people are suffering with these symptoms and they just go on and on and on for so many years oftentimes and not know what's going on. So I'm just thrilled to be here with you having this conversation today. So thank you.
Well, on behalf of all our listeners, thank you for being here. Now, you did have some issues with yourself with mold. Is that correct?
Oh gosh, yeah. I think so many of us that get into some of these professions, especially from like the healing side of things, we come across this oftentimes when we have our own issues. So for me, it was so many things. Like at one point I thought I was dying. I was looking around for deserted islands all over the world, figuring out like, okay, well, if I can find some sort of hut someplace, can I go live cheaply? Because I thought I was moving in a direction of not being able to work and take care of myself. I had so many symptoms, head to toe. But one of the number one things I had was just chronic pain that was so bad. And some days I would get stuck in sitting positions because I couldn't move because of the level of the pain. I'd occasionally have people like actually lift me off toilets because that was like the most embarrassing place to get stuck, and it's like pain so bad. It felt like my legs were being sawed off. I was having memory loss. Some days I would forget where I lived. That's
Wow.
scary as heck. So a lot of like loss of feeling and those sorts of things. And, it's a conglomeration of many different root causes, but mold illness was like one of the number one things and still continues to be like really important. Like I take where I live and where I go very seriously still, because what happened is that just spun me into so much research and learning about, wow, when we have mold toxins in our brain, and I know you know this, but I imagine some of our listeners don't, it actually is causing some of our nerve cells to die. Right.
Wow.
And so some of that dementia that can come with it, or the brain fog, or the weird neurological symptoms are really because our nerve cells are actually getting so inflamed that they're literally dying. And there's studies that show this. And I'll take a pause in a moment, but before I do that, just real fast, I want to insert here that anytime I talk about nerve cells dying, I always like listeners to also hear like, this is fixable. We want to take it seriously, catch it early, these sorts of things. But we do know nerve cells can regenerate. So if you're hearing this and scared, I always like people to know, like, don't be scared, just take it real seriously. Find the mold, work with people like you, fix your body, work with people like me to really get this reversed.
Yeah, and I think that's important for our listeners to understand that you can change course and heal from this. A lot of people think it's permanent. And can you address that a little bit, as far as we have to work together from the home side of things like I do, along with the medical professionals? Can you just address for somebody that's listening and they think, man, I'm hurting all the time, like just like you were explaining, what steps do they need to do? Which I want the doctors to say this. You have to remove yourself from that moldy environment. But on the other hand, we understand you can't just up and move. So for a listener that's sitting here wondering, well, I'm in a rental, I can't afford it, are there things that you can do on the medical side of things to improve that while they're still in the moldy environment?
Yeah, it's such a good question. I'm so glad you asked that because it comes up all the time. Because obviously, there's a lot of things that go into moving and fixing a place. The number one thing I think is super important for people to understand is after almost 15 years of doing this, I've never seen anybody really make it to anywhere close to full recovery when still in that moldy place. I'd like people to know that because yes, like we can certainly do things to help mitigate the symptoms like a little bit. We can give anti-inflammatories. We can do sometimes detoxification support. So I've had a lot of luck with a peptide recently called KPV. This is a peptide that I've seen for people that get in that mold situation where they become hyperreactive and develop like MCAS or histamine intolerance, where they're like, wow, I'm just reacting to everything. I had an MCAS patient once that she couldn't even shower because she was actually reacting to the chemicals that were just coming through shower water, touching her skin, and it was breaking her out in like full body hives from showering, right?
Wow.
So I've seen KPV really help with those people that are just having that huge inflammatory reaction. I've seen KPV work better than a lot of like the mast cell type stabilizers. A lot of people are using things on the market like pharmaceuticals like ketotifen or cromulin. And I've seen KPV oftentimes work way better than those, because I've even seen people react to those. So yeah, KPV works really well. I've seen herbs such as TUDCA. Like one of the things that happens oftentimes when we're in these moldy environments is we wind up having our bile flow stop. So when we're detoxing, the liver breaks things down, the liver breaks the mycotoxins down, puts the mycotoxins into the bile, we excrete the bile and the mycotoxins together. But what will happen for a lot of people is that bile doesn't move. So we have this vicious cycle that can happen where people wind up, say that the mycotoxins wind up slowing the bile flow, right? So we have the need for the bioflow to get the mycotoxins out, but then the mycotoxins slow the bioflow. And so that's just kind of this like self-fulfilling prophecy, right? Because the mycotoxins are actually preventing the detoxification of themselves.
Right.
And so sometimes giving something like Tudka or myrrh or choline, these types of products that really help that open those bile pathways so the bile, can flow better. Those can sometimes help alleviate some symptoms when people are in it. And, this is I think a good question for you, because one of the things that I know that a lot of people will try to do when they are in this position where they can't move, right? So a lot of times people will ask me about the medical side, and then it's like, okay, for the house, like, what are your recommendations for people when it comes down to common questions I get around like, well, can I fog, or can I, diffuse like these, propolis or essential oils, or, all these kind of home remedies. Like I imagine you tell people like, don't go and just like start bleaching your whole house, right? So what do you say from the house side of things to people on that?
So just a quick once over. One thing that I have to really tell people all the time is you have mold and then you have the mycotoxins. Once those toxigenic molds produce and release the mycotoxins, they're going to float, they're going to go anywhere they want to go. When people want to jump just to running air scrubbers or air purifiers or fogging, depending on what they're doing and the entire situation, they can actually make it worse. It's kind of complex because every situation's different, but at the end of the day, if you're getting fresh air, that's good. But if you think about it, once you open those windows, you have the pressurization of the air in the home. And a lot of our listeners will understand this. If you have a window open, you come in your front door, your back door, it slams. Well, what that is those are pressures inside of your home that could do things that will actually pull air from areas you typically don't get airflow. Like the stack effect, when we talk about mold in a crawl space, a lot of people, they think and assume, which they're correct, that that's a concern because heat rises. So they figure the mold in the crawl space is going to end up in the living area. Well, on the flip side of that, we have people that think mold in an attic cannot come down into the living area, which isn't true. So once you have those differentials with the airflow, we don't even know what it's going to do. Barometric pressure has a lot to do with that. And so to answer your question, and I say typically a lot because we don't know the exact circumstances. For those that think they're going to go buy mold stat and put it in a fogger and walk around their house and fog, they could be making things worse. So it's a complex thing because when we do remediation, we're inside containments. And for the most part, depending on what we're doing, we're using either negative air or air scrubbers. So we're kind of controlling the airflow. But when a DIYer does it, they're just kind of willy-nilly doing whatever they think's going to work. And the whole spray and stuff with bleach is just a terrible idea. And I hope our listeners know that. I'm sure you know why. But the easiest way to explain it is if you spray, let's say I think I have mold right here on my desk. It's got a nice clear coat. It's got a finish. It's not going to really hurt anything. But if I spray it over here on the wall next to me, that's semi-porous. And so 95% of that bleach is water. So the 5% of that chemical quickly evaporates and goes away. And what's the water going to do? It's going to soak into that sheetrock. So you're literally feeding the mold because the mold is just like your grass. It wants to root deeper. So that hyphae wants to go to wherever it's finding moisture. So to answer your question, for our listeners, I hope they know, don't try to do it yourself. And I get it. Like you said, they're just trying to improve in that minute, that moment, that hour of that day. And if you try to do it yourself, you can actually make it much worse. So did I roundaboutly answer your question?
Perfect. It's perfect. Yeah. And that you gave me a piece of information that I didn't even know. Like one of my understandings with bleach has always been, hey, it actually will help the mold actually spread. So I've heard it described as almost like anything, like wants to survive. So we don't know when we spray something with bleach, with mold with bleach, that, oh, the spores are like kind of almost going into the air and spreading potentially.
Yes.
So I've heard that, but I like this, this other component around the water, I think is super pivotal. And, I feel like what you're describing, it's like you're the expert on the house, I'm the expert on the body. And there's so much similarities of how you're describing the house as the body. Like, even that understanding of the spores versus the actual mycotoxins, but also down to that desire of like finding an answer and just being like, we want to fix it right now. Because that's what I see sometimes too in people, from a standpoint of fixing their body. So many times it's like you get a urinary mycotoxin test back and it's so easy to be like, just go online and be like, well, I'm going to read about some detox protocols.
Dr. Google.
Right. Dr. Google. Like there's a lot of information on Dr. Google and some of it's good and some of it's not good. And, and so many times, like what I see from the health side of things is when people start to try to detox and they're already like the liver only, there's a rate limiting, component of the liver where the enzymes of the liver for detox, they can only work so fast. There is a limitation. And so usually for people, they're already probably at that rate limit when they're breathing in mycotoxins and, whoever, knows what else is in their body because there's usually more than just the mycotoxins. And so then we try to do these detox protocols where we're actually then oftentimes increasing our cellular excretion. And then when we increase our cellular excretion of any of the mycotoxins that have actually been stored in our fat cells, for example, then our load goes up in our blood and the liver can only move so fast. So in these scenarios, then it's like we're actually almost like increasing the exposure in our blood when we're trying these detoxification protocols rather than decreasing it. And, just like you're describing with the home around, like we try to do this good thing and I get it. Like I really get it because when I get lab tests back too for my health, it's always like, oh, we got to spring into action. But that order and the way we do it, it literally can make or, break how easy it is to fix it.
That kind of leads me into a question that I get all the time. A lot of my clients, they're in the moldy home. Sometimes, and usually it's the men because we're not as smart. We usually tough it out and stay in the home. The wife and the children go stay with the mother-in-law. And they ask me, so can I just start taking charcoal or whatever they can find over the internet? Obviously, I always refer them to the doctor. Talk to us about what these consequences could be if somebody is, they're toxic. We don't know what their blood work looks like. What if they just go buy some charcoal? What's that going to do for them?
It's a little unknown. So there was a study that came out kind of recently, and it was on red yeast rice, which is what we do in holistic medicine for kind of an alternative for cholesterol medications like statins. And that particular study tested 39 just random red yeast rice and found that 37 of them did not contain red yeast rice. So, when I see studies like that, it's like we really need to be careful because supplements are unregulated and there's benefits for that for sure, right? It allows us to get supplements easily over the counter, right? That there's a huge benefit of that. And consumers need to know what the risk is and how to evaluate that risk. So like the products that we use, that most of us professionally use, are ones that are third-party purity tested. And that basically denotes a company that hires another company that is not interested in the bottom line. So it's like, okay, if these are my supplements, I'm going to hire a secondary company that doesn't care about my profitability to come in and actually validate to say, hey, what my product says it contains, it does, and what it does not contain, it does not, right? And so the biggest thing is always when we're doing things and we don't actually know if it's quality, we're kind of, playing a little bit of a game of Russian roulette with our health, where it's like, well, maybe what's in there is in there, maybe it's not. And the other component with that is like, if somebody is reacting, then medically, it's kind of like another example of like how somebody fogging or, ventilating and trying to fix things himself, like almost makes it harder on, for you around like, oh, we're going to make this a little worse and we're not going to see where, if it's flowing, it's just going to take more time to fix. And it's kind of analogous to that on my side of things, because if somebody comes and they've tried something like charcoal on their own and it's a non third party purity tested company, then we don't know if their negative reaction in this example could be due to the fact that that's a really, bad product for them. We have to work with that. We have to be careful. We have to come up with other strategies, or if it's because it is actually a poor quality product. And the same thing, if it's working, it still gives us a sense of like, well, what is that dosage in there? How do is that dosage accurate? Like, how do we monitor it? So it just leaves a lot more to chance and the unknown. And it is a level of risk, I feel like, especially when people tend to be so sensitive and, super highly reactive. Sometimes doing one wrong supplement, I've seen people take their health, which is oftentimes already like a 1 out of 10 as far as how good it is, 10 being good, 0 being bad. And sometimes taking the wrong supplement can really detract it to like say that 1 to a 0. And sometimes that can go on for a month before somebody gets back up to their normal bad of 1. So I just find that we just want to be thorough and careful. And just like with the house as well as the body, we really want to work with somebody that knows that can help guide us so that we don't make the problem worse.
Yeah. So at the end of the day, for our listeners, don't try it on your own. But it brings up another question. And once again, I try to look at things, and if it makes sense to me, okay, I'll maybe buy into it. But a lot of times what I hear as far as the testing side for mycotoxins, our listeners know you have My Myco Lab, Great Plains, which is now Mosaic. You have Real Time Labs. Real Time Labs is actually where we do the EMA testing. Our kits come right from them. You have Sunrise, you have LabCorp. Anyhow, they're all going to argue a blood test versus a urine test. And when they ask me, like, my easy answer is, well, and here's the most common thing that gets said. Well, in urine, it could be that you're excreting the mycotoxins and we don't know. Can you explain to our listeners from the medical side the pros and cons to each, the blood or the urine testing?
Most of the time, what I see happening in blood testing is actually not testing for mold or mycotoxins. It's testing for our immune reaction to it. So it's testing for this type of reaction that is our immune and antibody reaction, where it's our immune system actually going after the particular mold. And so one of the problems, like, that's great to know if that's happening for sure, but especially for people that are not trained in the diagnostics of this, oftentimes people don't understand that that's typically not for most people what mold illness actually is. That it for most people is really, most of the time, it's the mycotoxins, not necessarily our immune system reacting to the mold. That's the problem. Okay. So I'll say that again, because I think I said that a little bit unclearly. So I'm going to say it slightly different way. So because our genetics, for so many people, because we have this genetic anomaly of not being able to actually see the mold, the genetic anomaly is where our immune system doesn't tag the mold appropriately. And when the immune system doesn't tag it, it doesn't see it, doesn't remove it. And so it's not so much of our immune system creating this like antibody type of response like we would to a bacteria or a parasite. And that's usually what we're looking for in the blood. For most people, it's actually more this genetic situation where the mycotoxins are built up. And what I can tell you clinically from like the urine perspective is I definitely have seen situations where people have, moderately low levels of mycotoxins in their urine. And I mean very moderately low, like kind of barely into that moderate range. And we test their house and their house is fine. So, in those situations, like maybe it's their work, maybe it's, someplace else, maybe it's their grandparents' house, their friend's house, whatever. In 15 years of doing this, I've yet to see a single person, and I'm sure somebody will stump me someday, but I've yet to see a single person where they get into those high moderates and high levels in their urine and it's not in their home. So I really see that there's also this level of understanding from a urinary mycotoxin. Like, yes, this is a normal detoxification process, but you still shouldn't see, even normally, you should not see, 4, 5, 6, 7, 10 different, these mycotoxins in the urine at these really high levels, unless you are flooded. Your body is flooded with them.
Okay. So it brings up something else that you specialize in. It's Lyme's. Can you explain to our listeners? And the way it's been explained to me, it kind of makes sense. But on the other hand, I don't have the training. Why is it that we always see this correlation with Lyme and mold toxicity?
I think there's a few different reasons. I love this question. So one, from a genetic perspective, just like we were saying, hey, there's this genetic abnormality where we can get the toxins built up from Lyme. Some people have what's called a multi-susceptible gene, and people that have that genetic anomaly, what will happen is, just like I explained how the immune system doesn't recognize those toxins from Lyme, the multi-susceptible gene will make somebody not detox the mold toxins, but also it'll make them not detox the Lyme toxin. So somebody with this gene essentially has the ability to, say, bioaccumulate both mold toxins as well as Lyme toxins. So that's one reason. But also another thing that I really feel like is happening with what I'm noticing is essentially we know that Lyme disease can go into remission, right? So it is kind of like, chicken pox for those of us that are old enough to have had chicken pox as a child, how chicken pox can show up as shingles later on, or Epstein-Barr, mono. We know that reactivates, right? So we know these certain viruses can reactivate. Well, bacteria like Borrelia that is caused by Lyme can also do that. And so essentially what can happen is somebody could have had Lyme, maybe even like a super acute, cleared, they took antibiotics, they took herbs, it cleared from the body, and they felt fine. And then all of a sudden they move into a moldy house. Well, what makes Lyme tend to reactivate is going to be one of two things most commonly: stress or something that is causing the immune system to not be able to keep it in remission. So now we have the immune system that needs to wake up and get these mold toxins out because somebody's in that moldy environment, and that Lyme then comes out of remission. So I think we have like a little bit of, a couple different things. The other thing that is always really important to mention is that Lyme and mold, like they're great mimickers, meaning they mimic so many different disease processes, and they also mimic each other. So there are some textbook things, that would show up a little bit more as mold or a little bit more as Lyme. But really, when we get down to what happens is like far as us humans, because we're not textbooks, is that the symptoms can be almost identical. And so I think another thing that can happen sometimes is people don't have a full diagnosis, and at some point they've picked up a second condition, whether it's picking up Lyme or moving into a moldy place later, and it doesn't get recognized for many years because somebody was just like, they already had that Lyme diagnosis, or they already had that mycotoxin diagnosis, and they think they just haven't found that right treatment yet, which oftentimes can actually be not that as the problem, but they haven't actually found the other key component. Sometimes the missing part is Lyme, sometimes mold, and of course, sometimes something else.
And so when you are treated for Lyme, if somebody only has Lyme and you've done the proper testing and you know that, is it treated differently than mold? Meaning, here's a better way for me to ask. Is it often misdiagnosed when it's mold toxicity versus Lyme, when you're toxic from mold, but it's diagnosed as Lyme?
I almost see that mold is missed more than Lyme. I have a lot, and that just might be like because my clinic, even though I treat both, is branded as my Lyme doc, even though pretty much all of my clients have at least one or the other, and usually both. And so it might just be who's coming into my clinic. But what I see most commonly is people have a Lyme diagnosis and they've gone to 12 different docs, 14 different docs, and they come to me and the first question is like, well, what can you offer me? Like, what sort of treatment? I've tried every treatment. What can you do? And they're looking for like some sort of like new radical treatment from me. And I don't have a radical treatment. I just know how to treat the body holistically and how to find, all of these roots that people are missing. And so it's more about the ability to fill in the gaps, right? And so I see most commonly people with Lyme actually not looking for the mold and think that they're done. Then when we find the mold, and that's, another reason I was so excited to find you is because so many times I think then we find the mold and people can be so resistant to even finding that because they had their home inspected. And I'm sure your listeners have heard this a bazillion times, right? They've had their home inspected by the classic like inspector that does the inspection before purchasing. And essentially they're told they're fine. And so that's really the biggest thing for so many of my clients. They think it's Lyme, we find mold, and then we have to move forward with actually convincing them to do proper testing and inspection, because so many people, of course, don't.
Yeah. And that's, one of I'm trying to think of the proper verbiage I want to use here, but, so many inspectors in our field we get a negative rap because of it. They come in, they do the inspection, most of the time, like you said, if it's for a new home purchase, it's a real estate transaction, it's a non-invasive inspection. The inspector literally can only visually try to see. They run a few air tests, they do one outside for a baseline, and they do a couple in the house. And then the mold inspector looks at the numbers and is like, yeah, everything's fine. Well, then when you start to dive a little bit deeper, you ask like, well, did you do any dust sampling? Was there any EMA testing? Was there any ERMI testing? And a lot of the mold inspectors, you even mention that, and they get the deer in the headlight look. Like, and then when you even mention mycotoxins, they're like, they have no idea. And I get it. I got certified as a mold inspector years ago, and it's very, I'm not sure how to word this, but it's pretty generic. And you're not taught to dive deeper and to do wall cavity testing or dust sampling, because there is, there's and you and I have talked about this, there's a lot of bad stuff out there about ERMI and dust sampling. And it's like, in my opinion, the reason it gets a bad rap is a lot of people push only a dust sample. I have people that reach out to me all the time and they send me their ERMI results. And it's like they ask, so what do you think? And it would be no different than a patient sending you, if I sent you my blood work that I went and had done last week, you didn't examine me, you didn't do any assessment on me, you'd be like, well, okay, this is high and that's high. But for the most part, Steve, I can't really answer that. It's the same. And I guess my point is a lot of it depends on the type of inspector you're getting, or and I'll say or the type of testing we're doing. Because something our listeners understand, because I talk about it all the time, air testing by itself is a terrible way to determine the indoor air quality for several reasons. First and foremost, there's more than just mold that's a concern when we talk about indoor air quality. On top of that, molds like Stachybotrys, they're a heavier, tackier mold. So we're not always picking those up in an air sample. And going back to what I was saying earlier, depending on the air pressures, this is just a snapshot. If you run an air test, it's the snapshot of that minute, that hour, of that day. Maybe we didn't kick up enough air, and so there's not Stachybotrys in the air. So for our listeners, that's why I always recommend with air testing, you should do some sort of a dust sample or even tape lifts, because the Stachybotrys we're typically going to see on top of the baseboards, on top of my desk, on top of a bookshelf. You're not going to pick that up in an air test. And the comparison I like to use is it's similar to only doing an X-ray versus doing an MRI. There's so much more we can get. And the air test by itself is only one piece of this indoor air quality puzzle. It's just difficult because I get it. People don't have the money to spend, $1,500 on testing. But on the other hand, I look at them and I say, well, if you miss a couple weeks of work, what's that going to cost you? And I always say, what's your health worth? So it's just interesting to hear somebody from the medical side pretty much say what I say. Like, we can't just take one little test and run with it. So coming back to the testing part, explain to our listeners what type of testing you prefer to use and when you would use that, like urine versus blood or whatever.
Yeah, I mean, my primary method is through urine. So, but I really like the company Vibrant Wellness, and I like them, like you mentioned, a lot of great companies in the market that do a great job with some of their mycotoxin, but for the mycotoxins for the body, for the urinary mycotoxins, I generally really like Vibrant Wellness just because of how thorough they are. I have not found a company that has a profile that tests for as many different mycotoxins as them. So that's basically where I tend to go. I only tend to use blood at this point for the most part from a cost containment perspective. If I'm seeing that there's that like the urine is not showing mycotoxins, then I'm still suspicious of it, because really what I'm looking for is, do we need to treat it or do we not? Is it present? Is it a problem of the body? Is it building up? So most of the time, usually if I suspect it, if I use Vibrant's urinary mycotoxin test because it's so thorough, I know the types, I know what's there, I know what to treat. And then I tend to follow up with the same sort of test. The reason I would tend to move on to say a blood would be we retested and we got like urinary mycotoxins and they're normal. And somebody still has a lot of symptoms and this still looks like mold illness, right? So in those situations, it's kind of like, do we want to do say a check and balance and look at the blood and see if there's anything different in there? And I do it that way in part because I'm trying to get as many different pieces of information as possible. So oftentimes I'm checking mycotoxins, I'm checking Lyme, I'm checking other hidden co-infections, chronic infections, thyroid, adrenals, the gut and more. So I don't feel like I need that duo test in the beginning because I already know if it's there and I know the type just from that urinary mycotoxin. Yeah.
It's interesting on the testing side because I get this stuff asked of me all the time.
Yeah.
How do they know whether it's an enviromycotoxin exposure or if it's food?
I'm so glad you asked me this question. It comes up, and especially because when you read the reports on these tests, the reports on these tests are quoting what research says, which is like, oh, mycotoxins are from oats and they're from barley and they're from peanuts and all these different things. And so I've had people say resist a home test, and they're like, well, I do eat oats twice a week, so this must be why I feel bad. So I've talked to other professionals in the field that have done internal clinical studies where they've done things like run a urinary mycotoxin test, eliminated and got all of the mycotoxin kind of dominant foods out of people's diets, and then rerun it and seen no change, as well as doing the opposite, run it and then have people actually voluntarily eat more of those foods and rerun it, and also no change. And so, it's like I've talked to, like I said, the clinicians that have done those kind of things. I've had my own clinical experiences that have been less, say, specific, like an internal clinical trial, but I've had my own internal experiences of, yeah, sometimes if somebody is like, peanuts are not healthy for them and they're an inflammatory food, getting them off of peanuts can make them feel a little bit better. I've never seen a case in my clinical career of eliminating those foods and having mycotoxins return to normal and have symptoms really go away. I haven't seen it. So, and when I've talked to my other, colleagues that treat a lot of mycotoxin illness, they haven't seen it any either. So I don't feel like what's in the food is enough to contribute to the condition. Is it worth trialing taking those mycotoxin food out and see like, oh, does this make a difference? Always. Like, let's lower your inflammatory load as much as possible. But I think we need to really make sure everybody's educated around like, this is not, if you're having these, these wild symptoms that come with mycotoxin illness, and you're seeing those, moderate, high levels of mycotoxins in your body, food alone just does not cut it. And people really need to be calling you, frankly.
Right. The reason I asked that is, to me, it seems like it's almost an easy scapegoat. Like, oh, it was probably food. And, to circle back, that's why it's important to have a team when you're dealing with this stuff, because you can send me a client and say, hey, Steve, we don't think it's in their home, but can you go over there and do an assessment and maybe some testing? And this is something that our listeners hear me say all the time. In my opinion, many people are going to disagree with this. It's not worth spending thousands of dollars in testing without having an assessment of the property. If we don't look at the property, we don't know. It's pretty easy. And when I say easy, in my opinion, it's fairly easy for me to go into a property, whether it's commercial or residential, and do an assessment and say, yeah, I don't think it's your environment that's making you sick. That's based on many factors. Did we find a bunch of water stains? Did we see a bunch of discoloration? How old is the home? Is the grading and drainage sufficient? Like, there are indicators to me on the home side of things that just throw red flags up there. But we always hear, and like I said, it's always the excuse I hear, well, I'm pretty sure it's not my home because I had a mold inspector, or we do routine maintenance on the home. And once again, it brings in the medical side of things. You can't just take one urine test and run it to the bank and say, yeah, you're for sure not being exposed in your home. But I wanted to get your take on that, because a lot of people want to jump to, well, it's probably food. And correct me if I'm wrong, what I understood you to say is it might and could be, but it's very minimal, correct?
I would even go as far as to say it could be I just want to emphasize, I guess, like the might and could be to down to say, like, if it is contributing to anything, any level, as far as like the true mycotoxin level of food is, it's probably so minimal or minuscule that if you notice anything, it's probably only going to be small as far as eliminating those foods. And I hear you. I have people that, like, without even testing their house, they will tell me they are 100% sure that they, and like people will use that phrase, I'm 100% sure it's not in my house. Well, that scares the heck out of me, right? Because I don't know about you, but like, other than the fact that I'm going to die someday, I'm not really 100% sure about anything.
Exactly.
Right. So it's like, we don't know if we don't test. And the one thing also to add that I think is important where, think if people test their house and that's where they start. And it's like, okay, their house, let's say they get a clean bill of, on their house from you, but they still are like, wow, this sounds, and they listen to your podcast and they still say it sounds like mold symptoms, still worth at that point. Like, that's great, of like, okay, clean house, but we still want to consider at least running some tests to see if it's in your body, because it could always be your work. It could always be, exposure from other places. So it's so much easier to treat and to work with when you're not living in it. But of course, just because you're not living in it doesn't mean you're still not getting exposed someplace else that you frequent a lot. And that's, building up in your body.
We've talked about it before in the podcast that, like you mentioned it might not always be the exposure in your home. It could be at school. It could be at work. It could be your car. Could be your parents' house. For me, I would like to blame the in-laws so that I don't have to go to their home. And obviously for our listeners, that was a joke, but that's the things that you have to rule out. Like, you have to rule out your environment. And I get it. Again, going back to testing, like, how much money are you willing to spend to rule out different things? But like I've said before, you can see is from the inspector side of it, we can pretty much tell whether it's a home or not. But I want to bring up something, and this is one of the probably the most common scenarios that I deal with my clients. So they're going through the medical side of things. They've moved away. They know the exposure is in their home. They've sold their home, went and bought a brand new home. I'm saying new construction. They're still sick. They can't detox. They call me up. They call up a mold professional. Hey, can you come do an assessment? Can you do some testing? Because they're not detoxing. What, as far as the medical side, which road do you go down? Because I've heard, and I hear it all the time, you have to open up the pathways to detox. Is that something that the Roto-Root or sinus surgery, there's a guy in Atlanta that has a patented procedure, the way he does it. What's your take on all that? Is it the person's not detoxing, or maybe are they still being exposed somewhere else?
We don't know largely until we test. So I definitely think exposure is a huge thing. There's also, just like you differentiated in the home, the difference between spores and mycotoxins. There's always a situation in the human body where it's like we become the house, right? Where it's like, okay, well, maybe we've eliminated the external, but if we've actually been breathing in spores and not just the mycotoxins, and the spores themselves has actually colonized and made a home in our body, then the spores inside of us are actually creating, and it's an internal mycotoxin production. So, that's where we get into like the antifungal world, but this gets really confusing to people because so many people come in and they're like, well, I have mycotoxin illness, and their doctor puts them on nystatin, fluconazole, and these standard fungal treatments. And sometimes that's an important thing, is to do the antifungals, but usually like almost never as a standalone, right? And because we do want to kill those spores if they're there. So that can be certainly something, as certainly a reason why somebody leaves or in a clean place and they're still having symptoms, is that they're the house themselves. Another huge thing is truly that, yes, like from the emunctory, from like the open up that pathway perspective, to take our listeners back to our earlier part of our conversation when we were talking about, and I was talking about the bile and that process of the bile draining. So the mycotoxins, remember, will cause the bile, and the bile, we need to get the bile flow moving to get toxins out. Mycotoxins actually shut down. It's what it is a protein transporter. So we have this like transport protein, and this transport protein is almost like this gate. Almost imagine like, Golden Gate Bridge going up and down, and this transport protein is basically in charge of gate up, gate down. And when gate's down, bile flows. When gate's up, bile does not flow, right? And so mycotoxins can make that gate go up, where there's no bile flow, and we can eliminate the mycotoxins, but maybe we've never taken that gate and put it back down yet. So the body isn't able to properly eliminate because of that. So that can be some of the problem. And that's why, working with a professional, I think, is so important as well, because it's not just about eliminating the mycotoxins. Like, it's definitely about eliminating the mycotoxins, but it's not just about that, because we have to also go in and repair and fix all of these little components, just like this gate, in order to actually not only eliminate the mycotoxins, but actually repair the damage that the mycotoxins cause.
That makes a lot of sense, because for my side of things, it's a difficult line to walk when you're dealing with a client, and I deal with it quite often, that they just can't seem to heal. And for the most part, and a lot of times, honestly, what it comes down to, their mom's home or somebody's home that they visit frequently has issues. And it's like, for me, it's tough to just say, well, you can't go to your mom's house. But on the other hand, I was curious to hear the medical side of things. So you explained it real well. I want to go back to, because people always relate to someone else's story. When you were dealing with your own issues, what ended up happening? How did you find out it was actually mold that was causing issues?
Yeah, it was. So there was a few different stages with this. So the stage where I actually was really sick, that was when I was learning about mold. And that was just by testing. It was just simply like I'd run all the basic tests, nothing was working. And I tested and there was mold. And then years down the
Tested
road,
your home.
that was my home. Yeah, tested
Oh,
my
okay.
home. Yeah. And then there was mold. I fixed it, moved out. I just moved out is what I ended up doing. Got better, moved. That was when I was living in Portland, Oregon, moved down to Colorado where I am now. And I moved into a house, got it inspected and tested thoroughly. All was good, felt great there. And then just like one day out of the blue, I just woke up and I feel off. And what was like interesting was despite my past, experience, it did take probably 2 months or so of this like worsening and me just thinking, well, it's been stressful. I've been taking on new clients and really working like super hard. And, maybe it's just like stress. And all of a sudden I just woke up one day and I shot up in bed and I looked at my partner at the time and I was like, it's mold. And I actually packed a bag in, the very wee hours of the morning and texted a good friend of mine who lives here, who's also a doc in mold illness. And so she, totally understood like why I was in panic, thankfully, and basically got out of that house. And since then have really, learned my lesson about, just making sure that I am not only always testing, which like I said, I did, but then also what had happened with that place I was renting. And there just was a slow leak that like had started behind things. And when I told the landlord, luckily he believed me. And so he tore up the house and he sent me pictures. And there was a ton of, he never told me what it was, but it was black. So maybe it was stacky, who knows? I think it was going on for, probably some time. So, likely was an element of stacky there. But what it's also really taught me is like, okay, well, not only do we need to make sure that we are doing good testing before we move in, but good home care. So I actually am curious, as a question I have for you is like, do you have suggestions for people that once they're in a clean place and they're good and everything's good, do you have suggestions on like day to day what they should be doing to just make sure it stays good?
So we have, on the preventative side, one of the least expensive pieces of equipment that a homeowner could buy is a humidity gauge. Obviously, I'm a little bit biased. I have one sitting right here. It's 38% in my office. We have one literally in every room, especially the bathrooms. But if you can literally buy a 3-pack from Amazon for $20. If you can monitor the humidity in your home, you can be one step ahead as far as prevention. Routine inspections. Every spring and fall, we do a spring and fall checklist. I can't remember for sure, but it's been about a month ago in the podcast. Every spring and fall, I do a checklist. Also, on top of all of that, if you have like a crawl space, you can put a Bluetooth humidity gauge. You just put a sensor down there, so you don't have to go down in there. I get it. People hate crawl spaces. You can do the same in your attic. If you pay attention to other people's habits. Like my wife, for instance, she loves to take long, hot showers. The luxury we have of instant water heaters, you can shower forever. When I was a kid, you couldn't do that. There are things like that people can do, but you can look at those habits and say, okay, make sure that we're monitoring the humidity, make sure that we're airing out the bathroom, because for the most part, it takes 24 to 48 hours for viable mold growth. So it doesn't just happen in an hour. 24 hours is plenty of time, in my opinion, to air something out like a bathroom. If you have kids that are splashing all the time in the tub, they're kids, but pay attention to the walls adjacent to, the tub itself. But there's a lot of things that people can do habit-wise and inexpensive pieces of equipment. These days, it's mowing is one of the brands, but you can actually buy, it's a whole house monitoring system. Your plumber installs it right at your main valve. You literally Bluetooth it to your phone. And if you're on vacation, like, skiing or doing what you love to do, you can be away from your home and see all of a sudden the water usage is going through the roof. Well, that would tell us there's a leak. You can literally shut it off from your phone. There's things like something I promote a lot. And the reason I came across it, it's called a Luft, Luft, indoor air quality monitor. Well, I got certified in radon years and years ago. And Sun Radon, which is a company out of Florida, that's who I was buying my machines from. Long story short, I have two machines that just sit in a closet and I never use anymore. But they created this monitor and it monitors the radon, humidity, TVOCs, ECO2, temperature, and air pressures. Those are great pieces of equipment. You Bluetooth that to your phone. You can literally monitor it. The monitor itself turns colors and it's pretty much a nightly thing. My wife always says, "Why is it red?" And it's usually like the TVOCs. But there's things you can do to, and at the end of the day, pay attention. Like, pay attention to what you're doing. When I was younger, I drank Red Bull every day. I thought it was great for me. As I've gotten older, I'm like, yeah, that's probably not a good idea. So for our listeners, if they can just pay attention to what they're doing, and pay attention to your home. Like, water stains are a huge indicator. We go to hotels and I literally find mold almost in every hotel room that I'm in. It's the beast. But if you pay attention to what's going on around you, it will help. And I hate to say it this way, but as a society, we have kind of gotten lazy. And, I don't know if it's devices we have or whatnot, but most people just don't pay attention. And like, I have a good nose. It has nothing to do with my profession, but I can literally walk into a room and go, yeah, something smells a little bit off. So to answer your question, there's a lot of things they can do, but at the end of the day, like, it's pretty simple things. Because the mold epidemic was the first book I wrote. And the reason that I wrote the book, besides my wife talked me into it, is we live in homes that are so sealed up. And on top of that, we have building materials that when they get wet, it's toxic chemicals, formaldehyde. There's a lot of issues when you get building materials wet. They weren't designed to get wet. So going back to what I was saying, just like my body was not designed to drink Red Bull every morning, So, but it brings up another question I have for you. Going back to the health side of things, another thing I hear all the time, and I want your take on it. I'm not going to mention the doctor's name. Prominent physician, started his own coffee. He claims, and I've heard this, and I don't know if it's misinformation. What's your take on, I get told all the time, coffee is likely to have mold in it. Have you heard that?
Yeah, I mean, I think anybody that's in the mold world has heard that. What I don't know is how many different types of coffee have actually, like, it's a difficult thing for me to speak of from a true research perspective, because I personally haven't seen a study that said, okay, well, this coffee has this much mold, and this coffee has that much mold, and that coffee has that much mold, and that coffee has that much mold. And to me, coffee is just another example of all these things that we say, like food. Like, I do think we want to put good quality stuff in our body. I think as much as possible, lowering that toxic load is a really good idea. So eating organic as much as possible, and, staying away from things that are sprayed with Roundup, like the GMO foods, those types of things to reduce that load. But to me, it's probably just like peanuts or anything else, is probably not, even if it's there, not significantly contributing to somebody's load. That being said, like anything else, like still some people feel better when they don't eat peanuts. So, if you test it and, by eliminating it and adding it back in, but, beyond coffee and like, say mycotoxins, I've had people drink mycotoxin-free coffee that have mold illness and report not feeling good on it, right? So I think there's also an element of, well, maybe it's just that some people don't feel well when they have mold illness and they're drinking coffee because they already are neuroinflamed, and that extra adrenaline, that cortisol that we get from that coffee increase is too much for their nervous system. So I've not seen any studies, from a standpoint of being able to truly comment and say like, yeah, like we definitely know XYZ percentage has mycotoxins, but I just look at it just like food, where it's like, hey, it's probably not really truly contributing to a great deal of the problem for most people.
Okay. Yeah, because my wife actually asked me this just a few weeks ago. The person that's doing it, she follows, and when she asked me, I explained it to her. I said, from someone that's not trained on the medical side of things, I'm not a nutritionist. I'm just a blue collar construction guy for the most part. It just doesn't make a whole lot of sense to me. And on top of that, I did a mycotoxin series on the podcast. I don't know. I think it was in January, but our listeners will probably remember it. But I did some research, and the USDA, so obviously we're only talking about America, but they spend billions of dollars making sure there's not mycotoxins in food. But an interesting fact that I came across was mycotoxins came about, and I don't remember what year it was in the 1800s, because of chicken feed, and ended up, it was some sort of grain or something that had mycotoxins in it. And so when you think about the food side, that's typically what I think of. But going back to what I was saying, like, it doesn't make a whole lot of sense to me that there would be mold in coffee. Like, the coffee beans wouldn't have mold on them, then they get ground down. Like, it doesn't, in my opinion. But I just wanted to hear from a medical professional.
Yeah, I mean, I think it could, just like how exactly do other things get some level of mycotoxins, on them. So I definitely think it's, that it's legitimately possible. But I think the bigger thing, like for me, I don't focus so much on that because I haven't seen a specific change around like, well, I drink this coffee and that and versus that. And it's a huge difference. Most of what I've seen is like coffee just doesn't work for me at all. But that's, in working through the lifestyle things with mycotoxin illness, as well as anything chronic disease, I just have seen so much variability. One person does great on paleo, the next person does great on keto, another person like can only eat 5 foods, which I don't recommend, and that's another thing to talk about. But essentially,
Is that the FODMAP? Is that
no,
what?
I mean like where people are so scared, so they combine like autoimmune paleo and keto and low oxalate and low histamine. I get these people from reading Dr. Google, and they're like, I've read all these things, all these foods are bad, I can only eat 5 foods, right? So it's more like fear factor kind of thing, which then allows and creates a system where our immune system winds up attacking those 5 foods, and then it can feel like we're not eating anything. And I've seen crazy things, like really sad things, where because of reading so many of these scary things online around all these things being bad, people are like, actually, I've seen like anorexic type of symptoms develop from this because people develop such a fear around this. So I think what's most important is just, as much as possible, again, it's like clean of quality foods. We do know that like decaffeinated coffee, a lot of the decaf coffee uses petroleum-based solvents as part of the removal of caffeine process. So there's a decaf process called a Swiss water extract decaf process, so that's really good. I also think drinking organic coffee, definitely good. So we want to, like lower some of these things, but then we also want to consider the whole picture and not say, hey, something is maybe going to be bad for us, in totality, without actually seeing like, okay, well, if coffee that says it's mycotoxin free, if you feel better on that, drink it. If you don't, it's probably not contributing to a major problem.
Yeah, I think mind over matter has a lot to do with, if you believe all your foods are making you sick, then that's what you're going to convince yourself of. It's a tough road to go down. And I know, like I said, it's interesting on my side of things how many of the medical questions get thrown at me. And of course, I'm not a medical professional, but I say all the time, like, if you believe all in the FODMAP or food map, I'm not sure what that's called, but I've had a ton of clients and I'm like, so what is that? And they're like, literally, you eliminate all these things and one at a time. And I kind of look at them and I'm like, okay, if that's what you think's going to work. I know people like my wife, if she has a lot of dairy, she gets all stuffy and she can see it. Like, it's clear as day. Like, oh, I didn't have any dairy today, I'm not stuffy. There's a lot of things that, in my opinion, well, if it works and you convince yourself it does. But another question I have, and here's something I'm told all the time, and I'm big on, there's a major difference between a mold allergy and mold toxicity. Can you kind of go into that? Because I tell my clients, well, if you take an antihistamine and it works, then maybe it's seasonal allergies. But on the other hand, in my opinion, there's a major difference between mold toxicity and an allergy. Can you just explain that to our listeners?
Yeah, it's really important. And this is another testing area where I see people get into trouble oftentimes, especially if they just go to their general doctor who doesn't, oftentimes know much about mold illness. And they say, hey, I'm worried about mold illness. Well, can I run a test? Most of the time, you're going to get an allergy to mold test. And an allergy to mold is really where your body is responding like any allergy, which is when your body releases histamine, right? So that's why you take your antihistamine and then oftentimes you feel better. So the problem is, while some people are allergic to mold and do have a histamine response, in addition to having actually true mycotoxin illness, a lot of people have mycotoxin illness where that mycotoxin level is built up in their blood, but they don't have that they don't have that additional allergy, that histamine related response. And so many times people will come and they're like, well, I already tested for mold. And I'm like, so let me see your test. And it's exactly what you're saying. It's like an allergy related test and it's negative. So then what happens, and why I think it's such an important question, is that people will then just make the assumption of like, well, I heard this podcast, I learned about mold, but I had my doctor tested and I'm negative. I'm like, well, no, you don't have an allergy. That means your body is not creating a histamine response directly related to the mold. Now, what's interesting is you're not having a histamine response related to the mold, which is what, from an allergy perspective, I'm talking about an IgE. So when the body secretes this protein, this immunoglobulin E, and that creates the release of histamine. So that's what we're talking about, an allergy. That's one way we can release histamine. Now, we can also have another way we release histamine. There's a few of them, but another way we can release histamine is through our mast cells, which contain histamine. They break down. So our mast cells have this like fairly strong outer wall that stays generally intact most of the time. And essentially something can trigger these mast cells, activate them, and they open up and they actually release a lot of histamine. So what's interesting is somebody can have a true mycotoxin illness that can trigger MCAS, that can trigger this mast cell. We can get this histamine release, and that's still not an allergy because they don't have, it's not their body actually reacting from an allergy mechanism to breathing in the mold. It's actually their body having this mycotoxin illness and the mycotoxin stimulating those mast cells. And so why that's important is both situations have an increase in histamine. So in either one of these situations, antihistamines can actually work. But that may or may not mean that you have an allergy. This is why you want to make sure that you're really testing what you want to test and just understand what's going on, because it gets, complicated.
Right. For our listeners, we talk about symptoms of mold sickness, and depending on Dr. Google, it could almost be anything. As far as from your perspective, what are the most common symptoms with mold toxicity?
Yeah, one of the most common big arching things I would say is just having multiple symptoms in multiple parts of the body. So like, for example, if your symptoms were like, well, I need to see a cardiologist because I have something in my heart, a gastroenterologist because I have something in my gut, an endocrinologist because I have a hormone problem, and a rheumatologist because I have a joint problem, right? So if you have symptoms that are widespread, where they're in so many different parts of your body, whatever they are, just as a general rule, that's a big thing that I would suggest to say you really should test for mold illness in your body in your house. And then more specifically, migraines and headaches. I see majority of the time some sort of pain. Oftentimes it is migraines and headaches though, but some sort of pain. The other thing that I see very, very frequently is some sort of neurological thing, something that's like going to drive somebody to get an MRI, which is always a good thing because we do want to rule out those big, bad, scary things. That allows us a lot of comfort to say, okay, well, those disease processes aren't happening while we get to the root. And so by neurological things, that can be, sometimes like noise sensitivity, light sensitivity. I've seen a lot of like ear ringing go away after years of having that symptom, for example. That can be POTS, that can be just this disorientation type of thing. So it can express differently, but I'd say some sort of pain, most commonly headaches and migraines, but it could be pain anywhere, some sort of neurological, dysfunction. And then certainly another big one I see is night sweats. That comes up a lot. And, this is oftentimes for women in particular, thinking things like, am I going into menopause early? Like, why am I 32 and I'm getting night sweats? And so somebody might come in and express like they're worried about early onset menopause and it's actually mold. And, of course, there's so many others. If I were to name one other major one, I would say like brain fog and forgetfulness, that loss of memory. Anything from simple things like, gosh, what was I talking about? Or where did I put my keys? To the more scary things that, that I and others go through of like, where do I live?
Yeah, because you dealt with that
Oh,
yourself.
yeah.
You can understand what that's like. For someone like me, sometimes I was talking to a representative of the lab, and I was saying what had happened was one of my clients just went and bought a test from them. And I'm like, well, why didn't they buy it from me? And he had a great point. He's like, you've got to understand, Steve, that a lot of them deal with brain fog and they just don't remember. And for someone like me, I get asked a lot, like, what's your story, Steve? And I'm like, I don't have a mold story that I know of. And the ironic thing is I've never even tested for mold or anything. And for as much as I expose myself, you would think that I probably would. But on the other hand, once again, it makes it difficult for our listeners to go, well, I deal with inflammation. I have high blood pressure. I have night sweats. They a lot of times want to think, going back to their home, they're 100% it's not their home. So it's interesting. But before we start to wrap up, I just have one more question that our listeners always want to know the answer to is once they start to detox, and I know every situation's different, but I hear all the time, I'm not getting any better. Once they have a doctor like you that knows what they're doing, how long should it take them to see improvement?
Yeah, I would say it's once somebody has a doctor like me and we know that their house is safe, right? And their house. So it's a combination of those two things both. And I want to make sure people really understand that. But usually, once we see that the house is safe and we can start moving through treatments, usually oftentimes the first few weeks, we'll notice something. Surely, almost in every case, by a month. What's really important, this is another reason why working with somebody is just, I feel like, pretty crucial, is because the brain so orients to what is wrong and not as what's right. Like my favorite story for illustrating this is I had a patient, she came in, her number one symptom was this face tingling. Her face just tingled all the time. She was fine on her MRI, but it was scared the heck out of her. And she had a lot of other symptoms, but number one was face tingling. So I see her, we run some tests. For her, the face tingling was actually easy to solve. I took her off gluten, I changed her diet. And 3 weeks later, fast forward just 3 weeks, she comes in and she's like, well, diet didn't do anything. So let's go over your labs. And I was like, well, okay, diet didn't do anything. Let's go through these symptoms one by one. So I'm like, well, how's your face tingling? And she stops and she's like, Dr. Diane, I completely forgot I had that. Right. So that's like what I see over and over again. So many times, if we're not working with somebody that's like tracking, like I write down every symptom that my clients report to me, and sometimes it's 50 of them. But I do that so if somebody comes in, we have a track record to say like, okay, well, I think it's not working. Well, okay, if it's not, then that's data. I'm a scientist. So it's like, if it's not working, then we need to pivot. We need to get you on different treatment. We need to run different lab tests. We need to figure out what we're missing. But most of the time, if we're truly on track, as far as the treatment's right, and we have found the most predominant root causes, usually, and they're living in that mold-free place, usually we can start seeing things, like I said, at 3-4 week mark, but it's usually going to be like, oh, I have so many symptoms, I forgot that thing that I even had that. So we'd have to track it to make sure like, oh yeah, you actually had 3 symptoms that you've had for 3 years fall away. You still have 47 symptoms to go, but hey, 3 symptoms are already gone. So we're on the right track kind of thing.
And that it brings up something my wife always brings it up in the podcast. I never bring it up because I don't think about it, but documentation is so important. I tell our listeners all the time, keep track of everything. And, if you can come to me, and I'm sure it's the same way for you, the hardest and the most expensive way that our listeners are going to spend a bunch of money is not keeping track of anything. Because if they come to you or to me, and you ask them questions, when did this start? What are the symptoms? I don't know. It was everything. And that's when it's going to become very expensive for them, because we do have to start from ground zero. If they can say to me on my side of things, well, it happened after Hurricane Katrina, or are you in the same home? Or this happened after our basement flooded or after we moved into this rental. Information, and I guess what I'm saying to our listeners, that's going to save them a lot of money. I know on my end it will, because if they don't know anything, we have to start from ground zero, and it's going to cost them a lot of money. So it transitions into, and we'll start wrapping this up, but tell our listeners what you provide, like your monthly subscription program. Just kind of explain to them what they can do to get in touch with you. Of course, I'm going to put all your information in the description, but talk to our listeners as far as if I'm a patient, I've already dealt with Steve's like, go to Dr. Diane. What can you provide, and how can that happen?
Absolutely. Yeah. So the easiest way to find me is just at mylymedoc.com. You guys can definitely get my book. My book it will go through Lyme, through mold, through common mistakes. I even have a chapter in there about like how to find a good doctor, how to interview a doctor. So if you're looking for somebody in your local space and you're like, I don't even know how to find somebody, I have a chapter on that. So it's really kind of start to finish around like how to find the people, how to think about treatment, how to make sure you're getting all the right lab tests, those sorts of things. So that book is It's Not in Your Mind. Another fun way of getting started with me is going to solvesickness.com. That is just about to launch here, and it will be by the time this goes live, which is solvesickness.com. I'm having a developer finish a very, very intricate quiz that we've been working on for about 8 months now. It's almost launched. It'll be launched here in the next few days.
And that's a quiz,
Yeah, it's a quiz. And this quiz basically is what I have collected as the most common, combinations that people have when they have Lyme or mold or thyroid disorder or adrenal disorder. And the purpose is not to replace lab tests, right? So I always like to be clear, like we're not saying like you do this and not your lab test, but I wanted to create this because so many times we get stuck in boxes around like, oh, this is even just Lyme and just mold. So this will give you the top 3 most common things. So it's another way of just kind of triggering your brain around like, oh, I did not think about this other thing. I should maybe bring this up to my doctor around like, hey, we haven't tested for this. We should test for that. So that's solvesickness.com. And then, yeah, I have a couple different ways of working with me in one-on-one, working with me through my group education program. So I have ways of, working with people and supporting people in various fashions all around the world, really. So, the easiest way of getting started, though, is just join any, through any of these links that are in the links below or wherever the links are in your show notes. And then the other thing, just because I know this is coming out April 29th, I think you had said, which is right before, it's a perfect time because it's right before Lyme Disease Awareness Month, which is May. And so in honor of Lyme Disease Awareness Month, I have so many promotions going on that month. I have book giveaways. I have my mindset and neurological retraining course giveaways, lots of other hidden surprises. So if you join my mailing list by any of those things below or in the description, you said, that will take you to my mailing list. And then you'll be able to, to get all that information about all the free giveaways I have going throughout for the month of May.
Perfect. So for our listeners, she just named numerous things. So there's no excuses. We will have everything in the description, but we appreciate you taking your time out of your busy schedule to be with us. Maybe you'll come back in 6 months or a year. And, hopefully your quiz, this new thing you've brought out, everybody will love. So thank you for being here. On behalf of all of our listeners, we appreciate you taking time out of your day.
Oh, thank you so much, Steve. I appreciate you too. It's so good to have somebody that I can refer to that I just really trust. So I really appreciate you as well.
Yeah, like I always say, we have to work together as a team. Our listeners, I'm trying to convince them of that you've got to get people. You can't just get someone like me involved. You can't just get one doctor. You have to work with a team of people. So, like I said, we appreciate having you.
Thank you for listening to this episode. Make sure you go to our website at cnccontractorservices.com and sign up for the mold investigation checklist. Again, go to cnccontractorservices.com and get your free mold investigation checklist today. You can also on cnccontractorservices.com find out more about Steve's courses and books and consultations. Once again, go to cnccontractorservices.com.